Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
All right, on a Sunday day that should have been raining, we are sitting out under beautiful sunshine at Rise Up Coffee, which is one of my favorite places, with Dr. Bryant Harris, who's with TruCentered Chiropractic Care. How are you doing today, man?
I'm doing fantastically well. How about yourself?
Awesome. Well, I'll tell you, you are I'll say you're the new guy in town, but I mean, you have a fairly new practice here in Annapolis. And I got to say that as I learned a little bit about it, and I try to go into these things not knowing a whole lot because I can learn more, I'm really intrigued. And you've got a little bit of a different chiropractic practice, which is a very difficult series of words to throw out than most. And we just wanted to sit down and talk with you and find out a little bit about you, your background, your practice, and how it works. So,
no problem.
I mean, how did you get into? First of all, I gotta say that my ignorance will show. Do you need to be a doctor to be a chiropractor?
Yes.
Is that something relatively new? And I say relatively new, 30 years?
No.
No?
No. So chiropractors have always had a doctorate degree as far as I've known. Unlike for physical therapists, yes, they more recently in the past at least 20 years, they recently went from a master's to a doctorate, and same thing with acupuncturists. They've ended up getting a doctorate. But chiropractors, as far as I know, it was a doctorate level degree.
Interesting. Well, Dr. Harris, how'd you get into it? What's what in 8th grade did you say, I want to crack backs for a living? And
so ironically, I did not always want to be a chiropractor. I wanted to be a pediatrician. I wanted to be a medical doctor. And then ultimately, my mother is what convinced me to become a chiropractor.
You always listen to your mom.
Always. It saved my mom from having 2 back surgeries. And my mom was sort of a chiropractic evangelist to that point. I had went to a chiropractor since I was 16 and didn't much think anything of it. I played lacrosse and I swam growing up. Got cross-checked to my head, and then I couldn't turn my neck, and that's what landed me in the chiropractor office. And I knew my chiropractor, and I played lacrosse with his kids and didn't think anything of it. And when I came back after my freshman year at Duke, I opted to speak to my medical doctor, and it sort of changed my trajectory based on that conversation. And I ended up listening to my mom after I came home from that conversation, and she was like, you should become a chiropractor. And it didn't deviate from my academic plans when I was in undergrad. It was the same exact coursework that I was already doing, so it wasn't that big of a switch. So it was just a matter of where I decided to apply, going to chiropractic school versus medical school.
Interesting. Did you play lacrosse at Duke?
I did not. I played club lacrosse. I actually did try out for Duke's lacrosse team, but since I went there for academics, and a lot of the kids there were on scholarship, I would have to take a scholarship kids position. And then the coach was like, you're not that good to take a scholarship kids position.
Reality sets in.
Just a little bit. Reality check there. So I ended up just playing club lacrosse there.
Okay, well, how long have you been a doctor of chiropractic medicine at this point?
14 years. I graduated in 2008.
Okay. You look a lot younger than that. I'm like, okay, well, does the ink dry on the diploma?
Yes. I do look relatively young, but I turned 39 in 2 weeks.
Oh, congratulations and a pre-happy birthday.
Well, thank you so much.
So where did you start? I mean, have you started your practice here in Annapolis or?
No. So in 2009, I actually started practicing in Sacramento, California.
I love that town. I don't like California as a rule. Sacramento and San Diego are the 2 towns that I really kind of dig.
You know what was surprising about Sacramento? Like, I went there knowing that I wasn't going to stay there for a long time because my chiropractic school was in the Bay Area, which I actually did enjoy. Sacramento, for being the capital, there isn't much draw there. Like, when I lived there, I asked them, what's there to do in Sacramento? They're like, you're close to Tahoe, you're close to Napa, you're close to San Francisco.
Get out of town.
Yeah, I'm like, but what about Sacramento? That's like, what's the draw? They're like, you're close to Tahoe, you're close to Napa, you're close to San Francisco. I was like, oh, okay. So it was what it was. So I was there for about a year, and then I moved back. So I'm originally from Bowie. I moved back here and I opened up a practice in Upper Northwest DC in Tinleytown in 2010. And I was there for about 4 years. But then the commute around the Beltway got a little bit too much for me, commuting from Bowie. And
how many red light camera tickets do you have to your name?
Surprising, since I knew where they were and I took the same exact route, not as many towards the end, a lot more in the beginning. But just know you can go 9 miles over the speed limit without getting a red camera.
Yeah, or the speed tickets. My daughter went to American, and everyone says, hey, was it a great school? I'm like, yeah, it was a great school. It was wonderful. Everything else, I said, but aside from the tuition, you need to put, if you're going to commute in there, if you can go to see them often, I would figure probably $1,200 to $1,500 over the 4-year period in your speeding tickets that you're going to get by the camera.
Connecticut Avenue is definitely
it's a moneymaker.
Oh yeah, definitely a moneymaker. Yeah, and actually, when I was up in off of Wisconsin Avenue in Tinleytown, I definitely saw my fair share of American students because it was basically a hop, skip, and a jump away.
Right.
But I ended up closing that after about 4 years, and what brought me to Annapolis was actually that I was a CrossFit coach here in Annapolis, and some of the clients at the CrossFit gym were asking me, did I know a chiropractor locally? And I didn't. Like, I knew my chiropractor that was in Bowie, but I didn't know anyone in Annapolis proper. So they asked, why wouldn't I just open up in Maryland? So I actually didn't have a license at the time, so I had to go through the whole licensure process to do that. And then
Is that real complex?
It's not real complex. It's just about a matter of making sure that you get your transcripts and stuff all sent over. You have to take a jurisprudence test, among some other things, but they don't offer the licensure tests, like, at least at the time when I took it. It wasn't something that was like, oh, you can just take it on a computer. It was only like offered maybe a handful of times of the year. So you have to wait until that time where they're actually allowing you. So it's just a small window.
And you got to pay the money.
And then you have to pay the money. Yes.
This is Maryland,
a little minor detail. You mean it's not free? There's not reciprocity if I just have a license someplace, so just give me somewhere else, you would hope, but they don't. So yeah, so I actually started practicing in Annapolis probably around 2014, 2015, outside of the CrossFit gym, thinking that I would want to work with CrossFit athletes. And then one of my first clients at the CrossFit gym was a midwife, and I did have a specialty and I wanted to see pregnant women and kids. And that opened up the doors for me to the midwifery here over at Anne Arundel. I got to meet a lot of the midwives. At the time, it was Bay Area Midwifery. And then I started seeing a lot more pregnant people and aiding them and allowing them to have the births that they want, you know?
Well, I think it's, you know, as I look at your website, and the website is TruCentered.com, and that's TruCentered.com. You somewhat specialize in the neonatal, prenatal, and pediatrics. And you mentioned, you know, that you were considering pediatrics at one point. So obviously that's where that passion comes through, I guess. And just because you hooked up with some midwives, is this where the and is the need of pediatric patients and pregnant patients so different than, I mean, it's a specialty that you're working with?
A lot of things with pregnancy and pediatrics, like, I did want to see more kids than anything else. I had a good rapport with kids. I grew up being a swim coach. I got along well with kids. They respond really well to my energy. But most people who have any knowledge of chiropractic traditionally relate them to cracking someone's back or neck, and a lot of parents have apprehensions around bringing their kids, and they're like, oh, I don't want you cracking or popping their neck or their back. So I realized that in order for me to gain the trust of the parents to bring the kids in, I'll have to work on the parents. So I got me learning more about pregnancy and women's health than I ever thought that I would ever know. And given the fact during pregnancy, for specifically musculoskeletal complaints, whether it's pubic symphysis dysfunction, whether it's sciatica, whether it's low back pain, whether it's headaches, a lot of the times pregnant patients aren't able to take any medications for it, and they're told often that that's just a symptom of pregnancy. And then it will go away after you give birth.
It's great. It's not bad if it goes away at noon today, but nothing like November.
Yeah. And it's sort of like you pathologize pregnancy, meaning like, okay, this is just something you have to deal with for the 9 months until you give birth. And once you give birth, then everything that you would think that's going to go wrong should be better. And then you'll be back to yourself again. And in working with pregnancy, you realize that that's not necessarily the truth. These things may be obstructing or may be an underlying sign that some other dysfunction is going on that needs to be addressed. And it just can't, sometimes it may not be able to be resolved through medication, because that also comes with its own risk with growing, this unborn child in your belly, in your uterus. So in working with pregnancy, I started to garner trust to the parents, and then they were able to see kids. And the same thing with kids. There are some things that I see with kids aren't necessarily what people would typically associate with a chiropractor seeing a kid for. And what I mean by that is, most of the time, as I said previously, most people relate it to having some sort of pain, whether it's going to be their neck, their back, or something in their arm or their leg. And a lot of times kids don't come out saying that I have a pain in my neck or I have a headache or anything else like this.
It's the pain in the neck. Nothing.
And what they typically present with is, okay, if they're colicky, do they have constipation? Do they have reflux? Do they have breastfeeding or latching issues? Do they have recurrent ear infections? More organic issues that a lot of the times is a watch and wait approach that a lot of traditional medicine will do. But a lot of times, or they may be put on some medication that they may not be sure that it may be working, and a lot of parents may not want to put their child, especially a young child, on medication, so they're willing to deviate outside of what the norm is to go for, quote unquote, an alternative, which is where chiropractic will fall into play.
You just gave me my aha moment during this here when you were talking about the women and women's health and everything else, and then you look at pregnancy and you take a healthy, normal, woman in a non-pregnant state, and the changes that a woman's body goes through during pregnancy. I mean, you've got the bump, you've got the extra weight, you've got the bloating. I mean, I've got 3 kids myself. I mean, I've listened to all of the complaints, 3 times, but and everything else. Okay, and you can sit there and say everything will be great in 9 months. Okay, but obviously you've got to deal with that during those 9 months or whatever it may be. But everything will go back to normal after, and it doesn't now. Okay, I've gone through life, especially for first-time parents. Anyhow, now I'm done and things are back to quote unquote normal, but now I got this like 8-pound thing that I'm lugging around with me all day. Maybe it's worn on a papoose on the front, maybe it's on the back, maybe it's on the hip, maybe I'm, and you try to get back into shape and everything else, and that makes so much sense that there are specific things that a mother would need. And I mean, you have a child and your life changes instantly forever. I mean, and that's for males or females in any number of different ways, but that makes perfect sense to me. Now, that was my aha.
Yeah. And it's also like, because one of these things that a lot of people don't understand is like, this child is growing and there's nothing that you're necessarily doing to aid for this child to be growing inside of a pregnant body. All these organic and physiological changes are happening innately. Like, you're not doing much. As I tell most of the pregnant people that I'm working with, listen, this is all happening without you making any cognizant effort to do this. All right? So with that being said, when I tell people the importance of chiropractic as it pertains to pregnancy, well, as it pertains to all things, is as a chiropractor, my goal and objective is going to be the same regardless of whoever I'm going to be working with. And that is to make sure that your body's going to be functioning optimally. And most people don't consider that. It's because if you think about how many cells have to divide and multiply in order for a fetus to actually grow and develop, there has to be some sort of nervous system. Your nervous system plays a huge play in this because that's controlling every muscle, tissue, organ, and gland. So if something's not functioning correctly, that's disrupting how that nervous system is going to be functioning and working, then it may not lead to the most optimal development of that child or the physical manifestation of pains or issues that a pregnant person may be experiencing as well, and which ultimately could also alter that pregnancy. Maybe they don't go into labor, spontaneously. Maybe their uterus isn't contracting the way that it should be. Maybe they're not dilating the way that they should be. Maybe oxytocin isn't being produced. Maybe they're stressed and that's causing all these other things. They're at elevated heart rate, elevated blood pressure. All these things that, are an effect of pregnancy not going or not functioning the way that it should be.
You're kind of blowing my mind that it makes perfect sense to do this and to look at other things. I mean, as I think a chiropractor, I think my back's out. I need my back cracked. But you were talking about headaches, okay, and that makes sense. If my neck has constantly got a little bit of a crick in it or something like that, well, maybe that is giving me headaches, and we don't necessarily realize it. I do like the fact that you're looking at a more holistic way of taking care of health as opposed to, because I do think that we are, as a society, tend to be over medicated. I think the medical doctor community is very quick to write that prescription for something, and maybe it just may be a case of waiting it out and it will pass. But to look at alternate means of making you more comfortable, more healthy, and healing, from an injury.
Yeah, because a lot of times as a chiropractor, my goal is trying to figure out the underlying cause as to why this could be going on. And one of the biggest things as a chiropractor, additionally, is we don't have prescription rights. We don't do surgery. We can't recommend over-the-counter drugs.
So you can't write a pain prescription for... No.
So the only thing we can do is actually give lifestyle modifications, exercise, recommend supplements, or, perform adjustments in order to address some of these things. So a lot of times that's what causes me to be, quote unquote, more holistic in that approach, is because if something's not responding the manner that it should be, is that actually the primary cause, or is that just going to be compensatory for something else that's going on? So take, for instance, if someone comes in with lower back pain, this is going to be the easiest thing, and I go through my exam and take, for instance, I can't reproduce that lower back pain. Who's to say that something's wrong with your lower back? Like, how many times has someone gone to their primary, they're like, all right, well, we can get an x-ray. Well, your x-ray come out clear, so I don't know why your lower back's hurting, so take this medication, hopefully this muscle relaxer, anti-inflammatory, take some Tylenol, non-steroidal anti-inflammatory drug, and hopefully it will resolve. But who's to say that it's not as a result of something else going on somewhere else in the body, and it's just being manifested in the lower back, because that might be the area of least resistance. So one of the analogies that I was taught a long time ago is, if you step on a dog's tail and it barks, do you muzzle its mouth or do you take your foot off its tail? The cause is from you actually stepping on the dog's tail. The effect is the dog barking. But they'll continue to bark despite you trying to muzzle it because your foot's still on its tail.
Absolutely.
That's what makes you want to look at something more globally and check out the whole person, because your body works as a system. So you need to evaluate it as a system, because everything's going to be responding to one thing or another.
Well, what happens when you get into a patient? I mean, I'm sure there are some patients of yours that do have medical issues and stuff like that. I mean, at that point, then, are you doing referrals to a orthopedist, or I guess perhaps a neurologist or something, I guess, depending on what is that?
So it definitely depends on what someone presents with or what other providers they've worked with leading up to that point in time. Depending on what they present to the office with, sometimes I may be one of the first people that they may see, and other times I may be, the last resort in terms of those things. So if I find something that's contraindicated, a red flag, needs extra imaging or more intense diagnostics, then I'll refer them to the appropriate person. During the pre-show, we were talking about insurance. It's depending on what the insurance allows as well. Can they immediately go to whoever that I would refer them to, or do they need to go through their primary, and their primary is make the referral to whomever?
Right.
So a lot of times I may end up referring them back to their primary, or I may refer them to get additional lab workup or something else, and then try to co-manage appropriately from that point forward.
Well, I find it, you mentioned co-managing, and I mean, I think that that's a great, I wish it was a little bit more prevalent in the larger medical community to co-manage it, because again, you've got your specialties here. And, I would certainly think that, I know I spoke with Dr. Funk with Rehab to Perform, okay, and he's a little bit different, but I mean, I'd imagine you guys would be very good together to co-manage somebody that maybe is coming off of I just wrecked. I need to come to see Dr. Harris here to get the adjustment. But in the time that I've been, adjusted and worked on and getting that back in alignment, we'll say, and I'm talking totally out my butt here, but my back in alignment. Now I found that my back has gotten a lot weaker. I can turn around then and talk to Rehab to Perform or somebody and say, okay, well, these are the exercises, these are the work that we need to do to get it back. So we're looking at the system.
Yep.
And, we're talking at one part of a specialist of a system, you, another part of a system specialist, you, and another part, and together we're going to bring it together.
Yeah, most definitely. And that, as long as people are open to that, and quote unquote, putting our egos aside, because most medical professionals want to think that they can do it all themselves.
Right.
And that could sometimes be a detriment to the patient, but it's like, okay, you also want to make sure that you're also allowing your course of care to run its route as well. But you also need to acknowledge when the writing's on the wall if they're not responding in the manner that they should be.
Right.
And you'll be doing your patient a disservice if you're not going to be referring, or you're not going to try to change something up to see if they'll respond differently with some other, modality or method.
One thing when you go into the emergency room, you don't have too much of a choice, but one thing that I've always advocated for, and I'd be curious to see if you agree with it, but that when working with any kind of a medical professional, whether it be an eye doctor, an orthopedist, or whatever it is, you've got to have a relationship, you've got to have a good feeling, a level of comfort with them. I mean, okay, you get rolled into the emergency room. Okay, it's the luck of the draw, whoever's on call. I get that, and thank God they're there to be able to plug the holes immediately and everything else. But I've always thought that a relationship with a provider is critical. I've got to feel comfortable before I sit down and have you do the I Love Lucy, walking on my back or whatever it may be, or taking my neck. I mean, there's. Yes, I can do that. Someday I'm going to do it, and I'm going to, really mess it up. And
let's hope that does not happen to you. But to your point, yes, there has to be a level of trust with whatever provider that you choose to utilize, in my opinion. Because if you don't trust them, then it makes it very difficult to adhere to their recommendations, specifically if that patient doesn't feel heard or feels listened to. So more often than not for me, and how I try to garner rapport, is by offering people a complimentary consultation. And how I feel about that is I tell people it's a conversation, not a commitment. And it's sort of just like if you're dating somebody, you don't know, you don't go into a date knowing that you're going to marry this person on the first date. You need to make sure that you're actually comfortable with this person. You feel like you're a good fit. You're developing rapport, and you feel like this person can actually make the changes that you want to see. Because there is an aspect of healing that is mental. Because if you don't believe that something's going to work, it's most likely it's not going to work. So if you don't trust that provider, it doesn't matter if they're the best provider in the world. If you don't trust them, it's not going to be as effective as you would want it to be.
That's brilliant.
So my goal is if someone doesn't want to work with me, it's no skin off my back. I was like, for me, it's like, okay, you find out what I offered, what I can or can't do. And if you feel like this is something up your alley, then we can move forward with it. But if you feel that it's not, no harm, no foul, we can go about your way, or I can refer you to somebody else. As one of my mentors have told me, again, I'm going to say a whole bunch of random sayings, is that I do believe that chiropractic may be for everybody, but that doesn't mean I'm everybody's chiropractor.
Makes sense.
Yeah.
Makes sense. Who are most of your patients? They come to you. I mean, are they, obviously you specialize in pediatrics and neonatal and prenatal. I mean, is it pregnant women and just recently pregnant women and little kids?
So as of right now, I am the only certified perinatal and pediatric chiropractor in Annapolis. So a big, large portion of my practice is pregnant patients, in addition to younger kids. I see a lot of infants more than I see adolescents, even though I am getting more certifications to work with kids that may have behavioral learning and socialization issues, amongst other things.
Where does that fall into chiropractic?
What, behavioral learning and socialization issues? The more I learn about this stuff is, think of it this way. Behaviors are a window into the brain. All right, and what I mean by that is this. For every action, there's a reaction. So if something's happening, their bodies are going to be behaving a little bit differently. So if, as a result, they're not getting appropriate input from their environment, or they're getting altered input from their environment, what happens is when you get things from your environment, it sends signals up to your brain ends up processing it and tells your body how to respond. But at any point, there's some disruption in that input processing output, there's going to be an adverse effect, whether it's going to be behavior, a pain, a discomfort, a symptom. So my goal is to identify what could actually be causing for that altered input processing output, identify is it coming from the spine or an external stressor, and help that brain be able to better adapt to those things so we have a better output as a result.
Interesting. Okay, so it's sort of like the foot on the dog's tail.
Yes. So that's ultimately what chiropractic is making sure that the body's going to be functioning optimally in whatever capacity that is, and removing any obstructions to allowing that body from functioning optimally. Because in my mind, symptoms are just a way of our bodies telling us that something's wrong.
Yeah, obviously.
And for us to stop doing what we're doing. Because what we're currently doing is not working.
It's pretty simple.
Yeah, because when I tell my patients this, and the thing is, there's a time and a place for medicine, and I feel that very strongly in terms of, whether it's pharmaceuticals or surgery. But when I ask my patients, they say yes, I have good blood pressure, and I'm like, okay, but you're on blood pressure medication. What if I took you off that blood pressure medication? What would happen? They was like, my blood pressure would go back up. So I was like, do you really have good blood pressure then?
True, you've got managed blood pressure.
You have managed blood pressure, but the underlying issue that's causing for
hasn't been resolved.
Hasn't been resolved.
Hasn't been resolved.
The medication is just managing it and making it ideally look normal.
Right.
But the underlying cause that's creating that in the first place hasn't been addressed. So my goal is to try to figure out what the underlying thing is, and then so your body can function the way that it should be. Because as of right now, it's not it's functioning as well as it can, given the information that is given.
That you've got the high blood pressure, and it's interesting. I like the way you think.
Because it's a response. The high blood pressure is a response.
I like the way you think. I like the way you look at that whole thing. That's amazing. Okay, so to come see you, we want to go to your website, TruCentered.com, and TruCentered.com. Your office is on Bestgate Road at 7-Eleven. Yep. Not at the 7-Eleven, but at 7-Eleven.
Across the street from the 7-Eleven.
Oh, is it across the street?
It's directly across the street from the 7-Eleven.
On Bestgate Road.
Yep.
And where are you headed next? How do you like Annapolis now that you've been in here for a little bit?
I do like Annapolis a lot. I am looking to expand a little bit more to get a bigger space so I could ultimately help more people, ideally. So I'm currently exploring options at the current time, but I don't plan on leaving Annapolis anytime soon.
So the expansion of the practice is not necessarily, other than size here. You're not looking to be the prenatal
that might be
Delaware.
That might be a goal of mine. Like, I did have a satellite office in Rockville during the pandemic, right before the pandemic started, and as a result of me commuting between Annapolis and Rockville, even though I know there's some people who can do it, that proved to be a little bit more difficult than I wanted, especially as traffic picked back up. I ended up closing down my satellite office because practice in Annapolis had a lot more momentum than the one in Rockville was having at the time.
That's impressive. impressive that you are the only pediatric and neo pre?
So it's perinatal. I say perinatal, and perinatal encompasses preconception, prenatal, and postnatal.
Okay.
But more often than not, people just say pregnancy. But it's just all the whole time around that pregnancy period. And just to clarify, I'm the only certified one. Doesn't mean I'm not the only one that
doesn't
works on
Gotcha.
them.
Gotcha. Yeah. Fantastic. Well, this is amazing that you developed this niche and you've really opened my eyes into the different types of aspects. I mean, I'm not going to be pregnant anytime soon, so nor am I going to be an infant anytime soon. But I never knew, and I think that it makes all the sense in the world, just because you've got people that are going through so many different changes, and certainly with infants. I mean, you know as well as anybody that, they come out as this little pea, and then 3 weeks later they're like this giant peanut, and then 4 weeks later they're, next thing you know, they're graduating from Duke and doing a chiropractic practice in Annapolis.
And that's what amazes me, and that's one of the most interesting when it comes to working with kids. As you know, you said father of three, correct?
Yeah. Want to buy one?
Yeah, they grow. Gosh, they're expensive. They grow so rapidly. If you think about how quickly their brain develops and how much it grows within the first 2 years of life, like if you see how much development that actually happens, they learn to speak, they learn to crawl, they learn to walk, they learn to eat, they learn all these things. And at that point, it slows down, but it needs nurturing to do so. And imagine this, it's as a tree, the saying is, as the twig bends, so does the tree. So if you aren't able to catch things early enough, then it can lead to things happening down the line later on that you're gonna have to address. So one of my mentors, again, as I said, I have a lot of sayings. If you change the beginning of the story, you change the whole story.
That's true.
Why not try to set these kids up with the best chance, instead of always just saying I'm just going to wait and see what happens.
That's a good mantra to follow in your whole life, not just necessarily raising children. I mean, if you get into a bad job, if it's let's just change the beginning of this story. This is this chapter.
Bad relationship, anything if you see the writing's on the wall, and you're like, well, we'll just wait and see. I was like, or you possibly could intervene, as long as it's not going to create any harm down the line.
Right. It was funny, a long time ago, somebody had told me, a business consultant had said, do you know the best day of the week to fire somebody is?
Any day?
He said, the day you first think you should. He said it was, and it was true. He said, firing somebody is always horrible. It's the worst job any business owner will have to do, and it's true. Once you feel that there's a problem, and again, it boils down to relationships and trust and everything else, and that's been broken for whatever reason. It's time to move on, and the quicker that it happens, the better off everybody is going to be. To do that. Well, this has been fascinating, Dr. Harris opened my eyes and gave me a couple aha moments, which is fantastic. TruCentered Chiropractic Care at 711 Bestgate Road in Annapolis. Possibly looking for a larger space fairly soon. TruCentered.com is the website, and we will have links and all that kind of stuff in our show notes. But thank you so much for spending a Sunday afternoon here under the awning at Rise Up Coffee, and it's been a pleasure to meet you and get to learn a little bit more about TruCentered.
Thank you so much for having me. It's been a pleasure as well.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.